Hello, I'm Dan Wise, host of Senior Speak New Hampshire. Today we have something of a different show. We are on the road in Portsmouth, New Hampshire for the New Hampshire Long-Term Care Summit. And today it's a day-long conference, and I've been talking and hearing from a whole lot of folks about long-term care, which includes both institutional care and also home and community-based care. And we've been talking and hearing from experts who are talking about the demographics of New Hampshire, about the ways that we finance the supports, long-term supports and services for people in our state, and also what are the settings in which it's provided, whether it's at home or in institutions. And one of the most important messages I think that's been coming out of it today has been that systems of care, the system of care that we have for healthy aging is something that's of concern to the entire state, because even if you are living independently now, or you are a working age person, it affects the finances of the state. It affects family members and may affect you in the future. If we need to make sure that we provide enough support to keep the system going, to keep it strong and resilient, so that it can serve all individuals, and that all individuals have the chance to live the way they want to, and with appropriate levels of support. So we're going to hear from a few voices of folks that I've met here today, and you'll hear some different perspectives on the current situation with long-term care in our state, and also what are some of the legislative initiatives or legislative bills that are coming up in session in 2026. This program is being recorded in January of 2026. But some of the issues, whether you're watching it now or you're watching it at some other time, these issues are not going away. The state's population is aging, and we will be talking about some of the demographics as well as some of the other subjects. So stick with me for my conversations with folks at the Long-Term Care Summit.
To the New Hampshire Department for Business and Economic Affairs, older adults over age 65 will represent about 28% of the population by 2035. That would be up from about the 23% that's projected for 2025. It's important to note that while not represented on this graph, children and the working age population is projected to decline over this time. So when we think about changes of the population, this certainly will have impacts on the workforce. In New Hampshire's population has been growing. However, we know that growth has been much smaller.
The really important thing to note is that this affects everyone, right? And so I think most folks, if you're not immersed in this and this isn't your work every day, assume that if their aging parent or a loved one needs care, that they can pick up the phone and get help. And I think that's the message we want to get across, is that unfortunately that's not the case. And that's why this is so very important. We all know life can change in an instant, whether it's that you're aging or something happens. And that system of care, we really are a unit. One affects the other. Just because you might be younger and able-bodied at the moment, right? If something happens, if hospitals are unable to discharge out to home and community-based care, that means hospitals get backed up. So if you bring your young child to the ER, there's going to have an impact there. So it really is crucial that every part of this system is working and working well for us to be a healthy New Hampshire.
Yeah.
Sources paid for about 70% of long-term services and support nationwide in 2023. So you can see Medicaid is that light green, that largest slice. Medicare is the next largest slice. So again, Medicare is not health insurance that covers long-term care traditionally in full, but there are incidental places where Medicare does interact with long-term services and supports. And then other public programs. So what's that? That's care for veterans, that's non-Medicaid funding for children's health coverage, and that includes in some states the Children's Health Insurance Program, and that's temporary responses to the COVID-19 pandemic. So there was funding for long-term services and supports in some of those COVID-19 related bills. Some of that was still included in 2023. It was a larger slice of the pie in 2021. And then you can see on the private side, there's out-of-pocket payments. That was about 14%. Private insurance was about 9%. Again, when we're thinking about long-term care, it's a different picture than what we see in terms of who's covered by what type of health coverage if we're looking at the population as a whole. And then other private funds is about 7%. And a lot of that is philanthropic. That could be corporate donations, support from other places that aren't just the individual and the insurance that the individual's been paying for. That's in that other private funds section. If we could go to the next slide, please, Jess. Thank you. So keeping those colors the same on that pie chart, how did it change from 2021 to 2023? Just 2 years nationally. How did that change? What you can see are in the solid bars are the dollar change, and in the striped bars, that's the percentage change in those categories from 2021 to 2023. Unadjusted for inflation, right? And there was a fair bit of inflation in this time period. But you can see that Medicaid, all the way over on the left, that's the tallest dollar increase, or the highest dollar increase, about $50 billion if we compare those 2 years. This is all from the Congressional Research Service, by the way. Now, that was a 24% increase. That was a big increase in dollars. Now remember, inflation over this time period, consumer inflation in 2022 peaked at about 9%. So when we're thinking about how much in actual services, it's a smaller increase in actual services there. And Medicaid itself was under the continuous enrollment provision at this time. So that probably didn't affect this, as for example, as much as it did the Granted Advantage program, like Medicaid expansion expenditures, but in New Hampshire. But that increase probably would have been a little lower without that continuous enrollment provision. Still a big increase in dollars. However, if we look at the percentage changes on the public side, we see Medicaid 24%, Medicare 10%, other public programs that decline. Some of those pandemic-related programs are ramping off. That's why you see a decline there. On the private side, out-of-pocket payments up 27%, right? Smaller dollar value than Medicaid, but a faster increase. Private insurance up 32%, other private funds up 29%. So when we think about how long-term services and supports are being funded, and this is just a 2-year snapshot, right? I just compared 2021 to 2023, and it's national data. But if we look at these data, they suggest that we're seeing more reliance on individuals and more reliance on private pay, even in a period where Medicaid is picking up that much of the tab and has the continuous enrollment provision in place. Could we go to the next slide, please, Jess?
Yeah.
And it's yours.
Thank you. So without public dollars, private pay is unaffordable for most folks in New Hampshire. So for those of you who were at the Long-Term Care Summit last year, or in 2024 rather, you likely recognize this graph that the Urban Institute had presented on long-term care from their most recent report. And this graph is essentially looking at the lifetime out-of-pocket costs for private pay individuals turning 65 between 2021 to 2025.
will say that boost over in the last budget cycle for Medicaid were significant boosts for reimbursement rates for long-term care providers in the state. This were boosts for nursing facilities, the Choices for Independence program that really helped providers keep up with some of the rising costs of living, really helped retain more workers, pay workers more so that they're able to stay with the organizations and provide that critical care. We saw in the current state budget, those increased rates were kept, but providers did not receive any additional reimbursement. So as we're looking towards the future, as more folks may need long-term care, that could be a challenge, and really keeping up with rising inflation in over the next several years.
Always have our eye on how can we keep people in a position to get the care where they want it. And what we've heard through listening sessions is that most folks want to age in their homes and have a choice about where they age. So we're always looking at legislation from that perspective. And when you start looking at that question, we're often looking at how to support caregivers, because caregivers are the invisible backbone. That's the term that we've heard across the country. And in New Hampshire, these caregivers support family systems, economic systems, and healthcare systems. So we're supporting any legislation that supports caregivers. We're also looking at what we've heard from our listening sessions about older adults really feeling financial stress right now on fixed incomes. And so we're also looking at laws that can expand maybe financial eligibility for certain programs, or also the resources and tools for individuals. So specific bills, there's a caregiver support bill that would add caregiver support services to 2 of the home and community-based care waivers, and also help grandparents raising grandkids be eligible for child care scholarships. We're working to increase eligibility for this very little-known program called MSPs. It's a Medicaid program. It pays for the gaps in Medicare. And could we expand that a little bit by eliminating that program's resource limit? People often don't realize that being on Medicare can be expensive. And finally, we're really looking at this bill that would hurt the last resort safety net for New Hampshire citizens, and this is local welfare. Most people don't know about it unless they've been in dire need. But those folks in dire need often need help with rent or prescriptions. And there's legislation to put a cap on what can be paid monthly, and also really limited residency requirements. So as we do our advocacy, we do a lot of listening. We listen to individuals in the community, and we listen to stakeholders, and have had the benefit of meeting some great people who really moved us in what we focus on and where our advocacy, where we center our advocacy.
So we've had people who have been willing to tell their personal stories to us and allow us to use those to talk to legislators and to help people really understand why it is that these are such important things to do. To some people it seems like such a small thing, but to the people that need that help is really huge, and the stories can really move you.
Again, some graphics to additionally describe what I said about health and safety are a must. They need to be there. But we have so heavily focused on survival so far, but there's things that we need to think about that are on the higher kind of hierarchy of needs, things like remaining being engaged in the community, making contributions, leaving legacy, and so on. So things like having a convenient lifestyle, having a connected lifestyle, enabling care in an easier and more fulfilling way. But also thinking about creating and contributing as a member of society. So thinking about what some of those needs might be, and it's inevitable for most people that as you age, things become a little more difficult. Maybe it's more difficult to get around and meet people, do things around the house, do things around the community. So the implications really go to multiple domains beyond just health and safety again. So implications for transportation and mobility side of things, which there is an example of right next to me. Finances, managing money, talking about money within the family and thinking about future planning and everything. planning for work in later life and retirement, thinking about home and community, so thinking about housing, what your homes might look like, what kinds of changes you might need to make. We're thinking about relocating, and communication and more. And again, thinking about different stages of design and how all of these decisions need to come together for a successful design to be done. So just a few examples of companies that the researchers at the MIT Age Lab have worked with, which kind of show that this really go beyond just thinking about call reminders and fall detection systems. Rendeavor is a MIT startup, and they use VR technologies to get people more engaged in the community. So some assisted living facilities use them to bring their members together and to give people who can't easily travel due to mobility challenges be able to virtually travel to places and visit their childhood neighborhood, visit places that I wanted to go to but never been to, or to visit a favorite vacation spot and show other people what they've done there. Honor is another company that we've worked with before, which is kind of like an on-demand service for caregiving. So thinking about having professional caregivers, but when you need them for the things that you need them for. Stitch is another example. It kind of turned into a dating site. It's more for things like friendship and interest-based groups for the 50-plus community. A lot of people I hear that now using for dating. But again, lots of different places that we can go to, lots of different issues that we can try to solve. And these are the three at the top are things that are specifically designed for older adults, but we can even think about things that are for everyone, things like smart appliances, things like smart thermostats and fridge, Alexa and other smart speakers and assistants, thinking about things like Apple Watch, which now come with Apple Health capabilities, and even connected automated driving technology. So all of these things that are developed for the convenience of everyone can really benefit older adults who have heightened needs around some of these challenges.
The Long-Term Care Summit this year brought together 150 professionals from across the long-term care sector. We had lawmakers, advocates, professors, people from the industry, practitioners, clinicians. And the purpose was to educate everyone about the state of long-term care in New Hampshire, identify some of the main challenges, as well as possible solutions.
Yeah, so there was a lot of talk about where the funding comes from for long-term care, which includes both home and community-based care, as well as institutional care, as well as where that money is going. And then there was also some talk about the demographics of the state and that sort of thing. And then what do you think of some of the takeaways from today that you take from that, and how would it influence the work of AARP in New Hampshire?
We heard from Wendy Altman, who's the Bureau Chief for the Bureau of Adult and Aging Services, who talked about what's in place already. So a few years ago, the System of Care for Healthy Aging legislation was passed, and the department has done a lot to try to implement that, and has made progress and has identified what more needs to be done. So we know what needs to be done and how to do it. Unfortunately, there have been some steps backward in terms of availability of funding and availability of services, with a lot of unknowns on the horizon about what changes at the federal level and at state level are going to do to the availability of services. There was some emphasis on, because of those challenges, people need to get involved, and they need to talk to their legislators, talk to the governor, to make their voices heard about what's important and what needs to happen.
Yeah, and there was also sort of a an interesting look at the future toward the end of the program. Can you tell us a little about that? It'll be kind of a little setup for some of the excerpts of speakers that we might have on this topic.
The final session of the day focused on the ways that technology can help to address some of the challenges in the long-term care system. And there are two in particular that I'm interested in. One is that there is a huge burden on family caregivers who provide a variety of kinds of services and are doing all that while trying to maintain their lives and their work life and their existing family responsibilities. And so anything that we can do that can help to alleviate maybe some of the trips that they need to take over to somebody's home or something like that, can provide real relief. Then also there are existing ongoing workforce challenges where there just are not enough people to fill all the demands for healthcare services, especially having health aides go into the home. So if technology can help to reduce how much demand there is for people going into the home, that can help. We can't and don't want to eliminate human contact. That would be terrible. But if technology can step in and try to fill some of the gaps, that could be a real long-term win.
Yeah, I think when you know how many folks are really totally isolated or very close to be totally isolated in their homes, technology can really facilitate that social contact. Either, maybe through the remote system, or even we saw a device demonstrated where it can help a person raise them from seated to a standing position where they can look eye to eye with somebody. I thought that was really great.
Yeah. Another point that one of the speakers made is that you could think about stereotypes of what older people need, and you think about how much medication they take, so pill reminders. There can be changes in their gait that can lead to falls, so there's fall detection systems, but there's a lot more that technology can do in terms of fostering social connection, in terms of fostering people's ability to learn and grow, which is really important for all of us.